Good afternoon. I'm Dr. Jennifer Russell, Chief Medical Officer of Health for the province of New Brunswick. I am so pleased to provide opening remarks for the annual conference of the New Brunswick Children's Environmental Health Collaborative. What a great time to be having a discussion on helping our children navigate through health and climate crises. Children have just witnessed the most significant public health crisis in recent memory. Living through this pandemic will be something that our children will remember and be told stories about throughout their lives. For some, this has been a time to re-engage and become more connected to the natural environments where we live. For public health, while we are still very much in the midst of responding to the changing facets of the COVID-19 pandemic, we are also aware that the impacts of climate change are here. All of us will need to use lessons from this experience as we continue to prepare and react to changing climate. Public Health New Brunswick has a long history of partnership with the Children's Environmental Health Collaborative. The collaborative is a great example of how work in population health promotion moves forward, not through one discipline or one organization, but through collaborative efforts across many sectors, many disciplines, many communities, and indeed throughout our society. This is the kind of collective effort that is critical to improving population and broader environmental health, and we are pleased to support it. As one of the social determinants of health, healthy childhood development is a critical piece to individual and population health. Promoting and protecting the health of children has been a core function of our public health system. But as you know, healthy childhood development is not determined by the surveillance and programs that we offer. They are merely tools that help inform and support the environments in which children grow, be they physical, social, or ecological. Creating the conditions for healthy childhood development requires commitment and contribution from many different sectors in society. It takes a village, the whole of society, and most importantly, healthy environments. There is no doubt that the COVID-19 pandemic has had many secondary and unintended consequences on children's health, and particularly on their determinants of health. Their education and social environments have been disrupted, and we know how important the role of our communities and education system are in supporting their health and well-being. The health impacts of the pandemic, both physical and mental, will continue to be with us for years to come. That being said, the pandemic has provided public health and our communities with a wealth of learning opportunities that can inform how we navigate our current and future challenges. What we have come to witness and learn about the unintended or secondary effects of COVID-19 offers critical insight for the work of public health and society moving forward, especially in the context of climate change and the potential impacts on our population. A pandemic is about much more than just a virus. It is also about how the virus interacts with existing social and economic conditions and how this impacts people, families, groups, and communities differently. We see this kind of differential impact during natural disasters and other crises, exposures to unhealthy environments, and we also see it in overall health of the population. The things that make our population, or even particular groups, such as children, either vulnerable or resilient in the face of a pandemic, are very similar to those that make us vulnerable or resilient in the context of declining ecological health. This is why it is so important that we focus on ensuring equitable access to healthy living environments for all, now and particularly as we look at what is changing in our climate and what it will mean for us. Plans for recovery need to focus on building resilience into our broader systems and on the even distribution of the determinants of health. We also need to ensure that communities have the capacity to adjust and adapt to the challenges and opportunities that will inevitably come their way, including in the face of climate change. We can do better, and the pandemic has made this hard to ignore. We need to take the lessons we've learned and take positive and progressive action. I'd like to speak to the incredible strength of our communities here in New Brunswick. Over the last 2 years, we have seen our communities put their collective efforts together in order to stave off the worst effects that this virus can have on communities and health systems. While our public health team has demonstrated great ability in navigating the challenging and fluid reality of the pandemic, the people and communities stepping up and doing their part has made all the difference. We can take pride in this, we can learn from it, and we can draw hope for what we can accomplish together going forward. Despite the magnitude of these issues, there is reason to have hope and optimism. As leading global health researcher, Dr. Ronald Labonte has noted in the context of the need for global structural change, the glass half full will galvanize far more than the one half empty. There is indeed reason to embrace a glass half full perspective, not without recognizing the reality, depth, and complexity of the problems at hand. But with diving deep into the science, supporting our communities, and doing our utmost to build on the progress we have seen in the past. We can do this.